Today, on the occasion of World Heart Day, we have with us Dr. Abhay Singh Walia, Senior Consultant, CardioThoracic and Vascular Surgeon, Apollo Hospital, Nashik. He will tell us about total arterial bypass surgery. Dr. Walia is the first cardiac surgeon of Maharashtra with experience of 22 years and specializes in total arterial bypass surgery. Good morning, sir. Welcome.
Good morning.
Sir, at the start, can you tell us what is bypass surgery and why is it necessary?
Bypass surgery is basically a form of treatment offered to people, or patient rather, who have blocked in their coronary arteries. Coronary arteries are the blood vessels which supply blood to the heart, and as a result, if they have blocks, then we get insufficient blood supply to that part of the portion of the heart. In bypass surgery, essentially what we do is we use conduits or grafts or vessels taken from some part of our body. These are either attached to the aorta or they are self-attached to part of the blood vessel in the body, and these act as new channels of blood which will carry blood to that part of the heart which is receiving less blood supply. This is performed in two forms. One form is where we can stop the heart, and another form where we can do it on a beating heart. So bypass surgery is a form of treatment where we re-establish blood supply to that part of the heart which is getting less blood supply as a result of block in the coronary artery.
What is total arterial bypass surgery?
As I said that we have to use blood vessels from the heart. We have conduits which we can use either from both sides of a chest. They are called as the left or the right internal mammary artery. They are the internal thoracic arteries. We can use blood vessels from the forearms or the hands, which are the radial arteries, that is the left and the right radial artery, and which graft which has been used most popularly all over the world for so many years is the vein graft, which is used from the legs, and they are called as they are used in the reverse manner. Now, if we use a vein graft to use as a channel to from blood supply to the heart, then we cannot call it total arterial. So total arterial bypass surgery means is that we use blood vessels from the heart or from the body, which are arteries which are used to carry blood at the same pressure, and hence total arterial bypass surgery.
What are these grafts or vessels?
As we said that we can use blood vessels from the left and the right side of the chest, that is the internal mammary artery, or from the hand, the radial artery. Internal mammary arteries are basically running on both sides of the chest, and these particular arteries have got a special type of function that they can grow as per the demand of the blood supply required. That means if this particular artery is attached to only one vessel of the heart which is blocked, then it will have a blood flow in a particular amount. But if this same artery is attached to two blocked arteries on the heart, then this particular artery can increase in size to improve the blood supply, and as a result of which this artery will grow. The second feature the internal thoracic artery or the internal mammary artery has is that this particular artery is less prone to undergo atherosclerosis. Atherosclerosis is basically a disease of the elderly group, of the age-old group, and this is the reason why we get coronary artery blockages. So the rule same applies to the arteries of the chest as well, but it has been observed over the years that the internal thoracic artery undergoes less amount of atherosclerotic changes, and as a result becomes an excellent vessel to be grafted onto the blocked artery of the heart so that it can function for a very, very long time. Same is happening in the radial artery also, and these are the vessels which are used for bypass grafting.
Okay. The next question is, What is the difference between arterial and venous grafts?
Right. There must be a little confusion in the mind of the people who are listening to me today. Okay, we are talking about arteries and veins and what are these things? Our body has got arteries which take blood from the main vessel, that is the aorta, to every part of our tissue. And the reverse blood comes in the form of through the venous channel, that is the vein graft. So essentially these two arteries are supposed to carry blood at a different pressure. The arterial grafts, or the arteries of the heart, carry the blood vessel blood pressure at a normal blood pressure of 120, 130, which is our systolic pressure. Whereas the vein is not prone to carry blood at that pressure. It carries the pressure at a pressure of 7 to 8. So if we use this vein channel as a graft for bypass surgery, that means we are subjecting this vein to a very high pressure of 120. As a result of this, because this vein is not meant naturally to function like that, it is seen that this undergoes changes of stiffening, hardening, and blockages over the years. The literature says that the vein grafts, when they are attached to the heart, to blocked artery, 50 to 60% of them close down. Close down means they do not function as a channel which carry blood to that part of the heart over a duration of 7 to 10 years. However, when we use an artery, the artery is known to function for a longer time. The studies have shown that at the end of 10 years, 95 or 97% of the arteries are still open, carrying blood. The difference between an artery and a vein is that the artery does not undergo changes over the duration. And as a bypass surgery, we want that once a blocked artery is bypassed, it should be able to supply blood to that portion of the heart as long as possible, whereas a vein cannot do so.
How many vessels need to be used if there are more than one block?
Yes. Now, if the question in the mind of people arises is, okay, if I have more than 2 blocks, 3 blocks, 4 blocks, so how many arteries or how many veins are we going to use? We have seen, or we have rather been using now, both the arteries. They can be used in any form. Like you can use both the arteries attached to the native blood vessel carrying the heart. You can bypass maybe 4, 5, or 6 vessels. So if you have more than one block, then we definitely need more than one vessel. So the combination what we use as a total arterial bypass graft surgeons and all over the world is you can use the left internal mammary artery as one channel. You can attach one radial artery to that, so you create 2 channels which can carry blood to the heart, and you can anastomose 3 to 4 bypass grafts. There are some surgeons who do not prefer using one single mammary, so they use 2 mammary arteries, that is one on the left and one on the right, and then they join the radial artery to that, and then they supply blood supply to that many blocks. So if you have more than 2 or 3 blocks, even 4 or 5 vessels if they are blocked, well, we can, with total arterial bypass grafting, we can do even 5 to 6 vessels. There are surgeons who have been grafted 7 to 8 vessels also. So it is possible to graft as many vessels of the heart as required by even using 2 arteries of the heart, that is from the chest, or one from the chest and one from the hand. So it may not be required to use the vein graft at all.
Okay. Can we use arterial graft for all patients?
Yes. Now, can we use it for all the patients or not? Arteries, as far as possible, we can definitely do for most of the patients. But there are certain conditions in which we are forced, or rather we do not have the time. Like if you are in an emergency situation where you don't have enough time to harvest more than one arterial graft. In that particular situation, a venous graft becomes a life savior. So yes, at that particular time we do use the vein grafts. In case if the patient has got upper limb arterial block, where we often see patients who have a habit of smoking or who have disease called as osteoarthritis, very severe amount of atherosclerosis, they have blocks in their upper limb arteries. And the mammary arteries that we are talking of, which run on both sides of the chest, parallel to the chest wall, these vessels take origin from these hand arteries. So if you have blocks in these two arteries, then the chances of using arterial graft decreases. In that particular situation, then you use the vein grafts. So certain situations, like in an emergency situation, in a situation where the patient's upper limb arteries are blocked, or if their radial arteries are severely diseased, in such situations, then we do not have much an alternative, then we have to use vein grafts in these patients.
Okay. Sir, please tell us about minimum invasive bypass surgery.
Minimally invasive bypass surgery is a type of surgery in which we do not cut the chest wall, where we use the chest wall, that means in between the rib cages, we go inside and we approach the heart. So as in the initial questions I answered that in bypass surgery, essentially we are using vessels from the body, which we are using. In a conventional bypass surgery, we stop the heart and we go ahead and operate on the heart. But nowadays we do beating heart surgery. We do not stop the heart because we have experience enough to join vessels on the beating heart with the technology helping us. So we do it from the chest mode. The further advancement in this, that is how can we reduce the scar size, or whether we can approach from some other way. So minimally invasive, what we do is, okay, we go from either the left side or the right side of the heart, more or less on the left side of the heart in bypass surgery, where we enter the heart, approach the heart through the rib cages, and there we harvest or we remove the blood vessels from the chest wall. You can use the same technique as we used when we open the chest wall. You can attach the radial artery, or you can attach the other sided artery, that is the right internal mammary artery, and attach these two vessels together. And these two vessels, once we join together, you can approach through the left side of the chest. So minimally invasive surgery is basically more of cosmetic, less invasive surgery, needs more amount of training on the side of the surgical side, a lot of instrumentation, and we approach the chest, the heart from the left side of the chest, and we can go ahead and do the surgery.
Okay. My next question is, can arterial graft to be used by minimal invasive surgery techniques?
Yes, definitely, why not? As I said that you can use the left internal mammary artery, and you can join the right internal mammary artery from the right side of the chest. You can join these two arteries and you can approach it from the left side of the chest. If you are thinking that you don't want to give two scars to the patient, you can use a radial artery from the hand, and you can attach that to the left internal mammary artery, and these two vessels can be approached with the minimally invasive technique from the left side of the heart. Another point which I would like to raise to all our people who are listening is, we are talking so much about total arterial grafts, then we are talking about, but at all given situations, we try to avoid putting the vessel on the aorta. So what we are achieving by doing the total arterial minimally invasive or total arterial bypass with chest wall is we actually are not touching the aorta at any given point. Now, what are the advantages of not touching the aorta at any given point? The biggest advantage that we have is we are not actually using the aorta for grafting. So we are not making any incisions of the aorta, as a result of which we are decreasing the incidence of stroke, that is perioperative paralytic stroke, ischemic damage to the brain from this aorta. As a result, what we are preventing is we are preventing the patient of paralytic stroke. So what we call it as aorta-free total arterial bypass grafting, and the goal of all the cardiac surgeons in this world is basically to give the best blood supply to the heart, to the maximum vessels of the heart, with a graft which will last for a very long time and through a smallest possible incision if possible.
Okay, so my last question is, what message would you like to give to all the people who are listening to you on the occasion of World Heart Day, sir?
Yeah, there was so much amount of data or rather information I gave about what is total arterial and what is bypass surgery and why it is required. On the occasion of World Heart Day, we would like all our listeners to know, or rather message from my side is that today we should take a promise. The logo this time says, and the motto this time is that we make a promise, and we make a promise to ourselves that we stay away from this non-communicable disease, we stay away from this atherosclerotic disease, which is taking our life away. Now, how are we going to do it? First of all, we need not get into this myocardial infarction or ischemic heart disease. How do we prevent ourselves from getting into this trouble all over? We are seeing a lot amount of young patients coming to us with arterial disease and at a very young age with heart attacks. A lot of them we do salvage, a lot of them we cannot salvage. Every mind the question remains in our mind is, can we could have saved all of them? Yes, it's possible if we have a preventive goal in our mind. So on this World Heart Day, if we make a promise that we'll stay away from tobacco, we'll see that we'll exercise every day so that the blood flow to the heart improves. We take a good proper diet in the form of good healthy food so that our cholesterol levels under control. We will not shy away from taking treatment for diabetes, for hypertension. We will treat our obesity, and we will see that if we are more than 40, if we have any of the risk factors, we will get ourselves checked for the heart problems and say every year, okay, we do not have any positive result in our reports, they are negative, and this particular year we have achieved that we have taken this illness away. For those who have undergone an angioplasty, those who have undergone a bypass, they will feel as if we are now free, we can do what we want. Well, the message to them I would like to give them is atherosclerosis disease is still with you, it's not gone away. You can get a block again into those arteries which have been repaired by our people, by the doctors all over the world. So for them I would like to say is, okay, please do not forget to take your medications, do not stop them, see that your diabetes blood pressure is always under control, and if you particularly take the preventive aspect, as I said earlier, a healthy diet and exercise, medications, keeping the risk factors under control, then whatever procedure you have undergone, definitely it will give you the maximum benefit for a maximum longer time. So let's come together and make this promise that we are going to see this disease away from us for a very long time by achieving the goals that have been set by ourselves for us. That is, okay, we will have a healthy diet, we'll go for an exercise, we will quit smoking tobacco, and we will get ourselves checked every year so that we know that we are hale and healthy for the next coming years, whether we are operative or we are not operative. Okay.
Thank you, sir. Thank you for your valuable time and for the information. And a very happy World Heart Day to you, sir. Thank you.
Thank you so much. Thank you to all my viewers for this patient listening today, and wishing you all the best for the future. Thank you.